Cynthia Tieche, and I'm here with Dr. Tieche today from Ocala, Florida at Recharge Clinic. Today we're going to be talking about myths and misconceptions of testosterone in women. So I'm just going to read from a list of myths that I have written down that a lot of people think are real with testosterone replacement in females. Number one is it's only a male hormone.
This is a super common misconception that when I start going over hormone levels with both men and women, they're very surprised to hear that women have testosterone. But they do, and it was really discovered back in the 1930s that women have it. And it's, they have about 1/10 the amount that men do, but it serves the exact same function physiologically in men and women with both its mental and physical components.
So would some women who are super aggressive have more testosterone than men typically?
Well, I think you're jumping ahead with aggression, but that is not the case. Testosterone is not an aggressive hormone. And in fact, when people got supraphysiologic levels of testosterone in women, it did not have that effect at all. Now, what it does do is when you start increasing that, it does transform women and kind of do transgender. Interestingly, when you increase that testosterone level up, what happens is there's two breakdown products, DHT and then estrogen. And estrogen or estradiol really is the hormone that's associated with moodiness and aggression.
Okay. So the next one is testosterone is really only used for sex drive and libido.
That's a misconception for both men and women that testosterone, that's the only thing that it's useful for. It is one of its multiple components, but testosterone has really a mental and a physical component. And honestly, I feel most times that the mental component is the strongest of the two. It is really integral with moods, motivation, mental clarity, and energy. And when you think about that, what happens as people get older, both men and women, is the motivation and energy go down. So you just feel like at the end of the day, you're drained all the time. With women, as with men, we start noticing more moodiness with that. Energy levels plummet, so we just don't have any energy. Wake up tired, could nap during the day, and are tired all the time. But yet when we rest, we don't feel restored. Testosterone also has other functions, the physical functions. It's very integral in brain function, in addition to just how it affects our emotions, but really in protective effects within the brain as far as anti-Parkinson and things like that effects. But it helps with bone density. It's the only thing that naturally increases bone density in women. And so it's really important because osteoporosis is a leading cause of morbidity in women. And morbidity is, things that tend to make people have problems. And so what happens is we get older, we have osteoporosis, bones break, end up in the hospital, start having other problems with that. So it's the only thing that naturally increases bone density, both the outside of the bone, but also the marrow of the bone. And that's important because medications that increase bone density just increase the outside or the cortex of the bone. So they actually make them more brittle. It helps with muscle integrity. So everyone thinks that people that take testosterone have very large muscles, but it really just helps with the firmness of the muscle. And so as we get older, our muscles lose that stimulation from that testosterone, so they become more infiltrated with fat. We tend to burn less calories, and actually eating the same amount of calories on a daily basis causes us to gain weight. So that's why it's important to have that. That loss of muscle tissue is also called sarcopenia, and that is a really big part of aging that we try to reverse. It helps with triglyceride and cholesterol metabolism, which actually helps modify that and keep that normal, as opposed to taking statins all the time. People who have testosterone and thyroid that are out of balance, you want to try and correct those so that we don't have to be on those medications, because that's one of the main causes of that. Also, then it does help with sex drive. So it is involved with that, but that's, like I said, not the main cause.
Yeah, I think a lot of people think that that is the one thing, and that, oh no, I don't need it, my sex drive is fine, but really there could be a lot of other reasons that they need it, and that's just the symptom that they haven't had yet.
It's really the least reason.
Okay. So another myth is that it masculinizes women.
And yeah, so in this study they did that where there were some studies where they've given women 2, 3, 4 times the amount, and these were all done overseas in Russian countries where they allowed people to do that, but they really didn't see that transformation at that levels. Now, once you got even to super levels, super high levels, then you did see that. And we know that's the case because that's how we can do transgender from female to male. But in the therapeutic doses or in the physiologic doses that we use, you never see that. You never see beards. You never see production of an Adam's apple. People don't get any of that. They don't start walking around really burly and all of that. So it's a very common misconception, but it's not happened.
Another one is causes hoarseness in their voice.
So hoarseness, and I'm not really sure where that came from, probably from the masculinization thing, but it doesn't have any direct effect on the vocal cords. In fact, there's no receptors within the vocal cords for testosterone. There are many causes of hoarseness, and it's a very common symptom, particularly in women as they get older. And so women who are not even on testosterone develop hoarseness. Many times it's related to esophageal reflux, where you have that acid continuously bathing your vocal cords when you're sleeping at night, and that causes them to get thickened, changes the quality of your voice. Sinus drainage is another one, vocal cord polyps. So these things that are much more common that cause it, and we see that much more in women who are actually not on testosterone than women that are on it. So it doesn't really just all of a sudden change your voice and you start talking like a man, which I don't know where that came from, but that's another one of those misconceptions.
Okay. Hair loss.
Hair loss is another one that, if you take testosterone, you're going to lose your hair. And honestly, if you see people as we do, that one of the main complaints of people who come in, women who comes in, 30 to 50% of women, that's their initial complaint is hair loss. Well, okay, their testosterone are generally very low. So if it's the one that's causing their hair loss, well then how could that be?
Yeah,
So
gotcha.
really there's a lot of causes of hair loss. It just happens to be a common thing with aging. Really, thyroid is one of the most common causes of it. Actually, increase in testosterone in women increases hair production, not hair loss. And so stress, life, exposures to all other kinds of things are integral really with hair loss. And so just to say it's from testosterone, then how do we explain all of these other women who are not on testosterone that are having hair loss? So it doesn't make sense.
Very true. Cardiovascular effects.
So they believe that some people, and these were in studies in men, that taking testosterone was going to make you have a heart attack or a stroke. It was going to increase your blood pressure.
People still believe that, though.
They do. And really there was one flawed study, and it was retracted. No one ever read the retraction. And so they just keep saying this anecdotally. And what I mean when I say anecdotally is that just gets passed down from person to person. And this really happened in medicine. And I can tell you from my own experience, there's very little training on testosterone and education on it. So what happens is people just ask someone, that person just uses his anecdotal information and says, oh no, testosterone's bad, it's going to do this and that, without actually doing any research on it and reading it. So it's really sad that gets perpetuated throughout medicine when it's really not even studied. It does not cause any of those things. In fact, it has just the opposite effect in women and in men. It's very cardioprotective. In other words, it lowers the incidence of cardiac disease. It actually helps clean out the coronary arteries, increases contractility within the heart, lowers blood pressure, things like that. So it's very protective, not the opposite. It does not increase that kind of stuff. And there's many, many articles that support that. So to say that without actually, referring to the journals and the actual real medicine in it is really, really kind of embarrassing. But that's what we have, unfortunately.
Yeah, a lot of people do think that. A lot of physicians. Liver damage. Does it cause liver damage?
Well, this was a big thing. Say if you take testosterone, you're going to have liver damage, and bodybuilders all have liver damage and all of that. And again, here's the opposite has been the truth. It's never been that. There's really no reported liver damage, particularly in the way it's commonly used now, and that's called parenteral use. That's either intramuscular, subcutaneous pellets, or transdermal testosterone, and that doesn't even actually go through the liver. Now, there was a time when people were taking oral testosterone and even taking it in high doses, but still it was incredibly safe. There was some A couple of cases where people develop liver cysts, but they turned out to be benign. They were not cancerous in any way. And so I don't know, that got perpetuated that's going to cause liver damage, you're going to get liver cancer. That's not been the case. Even in bodybuilders who take super high doses of testosterone, that's not been the case. And I can tell you from our experience in following patients, there's no evidence of that. We never see an elevation in liver enzymes at all. So,
But you typically don't even do it from an oral way.
we don't do an
anyways.
oral form because
Yeah.
it's not effective and the dosing is not effective. But in the doses that we use, you never see that at all in the IM and the subcutaneous pellets.
Okay. Aggression, that it causes aggression.
Well, we touched on that earlier. It does not cause aggression at all. Even in, if you look at people who have taken really high doses, bodybuilders, for example, who are taking 2 and 3 times the amount, they're not really experiencing any aggression. Now, there have been people that have said, oh, this roid rage and that kind of
Yeah.
stuff, but those are generally from these other anabolic steroids that they're taking. Both men and women take them, honestly, in bodybuilding. And those things come from other animals. They're horse steroids and other animals' steroids that are not even meant to be used, and SARMs are not meant to be used in people, and they are, and so what happens is they have a lot of side effects. And these people really are sacrificing all of that for just their physiques, so it does cause that. But testosterone itself actually has the opposite effect. It's very calming. And in fact, women and men that go on it actually notice that it's very sedating. It not means to make you sleepy, but it just kind of calms you down,
Yeah.
actually helps you get through the day a little
Not
bit
so
better.
high stress.
And you're not so high stress, and you don't react to stuff as well.
Definitely. Breast cancer, that it would cause breast cancer.
So
That
this
women
is
can't take this hormone because it's going to cause breast cancer.
right, and so that's another one of these things that people talk about with all hormone replacement. It's going to cause breast cancer, or if you have breast cancer, you can't do it, and all of that. So there was no indication that increasing someone's testosterone actually increased their risk of breast cancer. And even women who had breast cancer who were put on testosterone had no change in that. Now, as long as and so I have to quantify that or qualify that in the fact that women who maybe have had estrogen receptor positive breast cancer who took testosterone would have to be on an estrogen blocker so they didn't increase their estrogen. But those women did not notice any increase. Now, if you just took the general population and they said, wow, hormones cause that, well, yes, in a way they were right, because it used to be that women were treated with very high doses of estrogen, and that did cause breast cancer and uterine cancer and cervical cancer. Estrogen. What happened is it was estrogen by itself, unopposed estrogen therapy. And what happened is when you mixed it with testosterone and equalized it as it is normally in our body, a ratio, that level or that incidence of cancer actually dropped below anyone that had any hormone replacement at all. So it actually had a protective effect. The two together had a protective effect over no hormone replacement at all. And then the worst is estrogen by itself. So the best is to have testosterone and estrogen, and then or nothing.
Interesting. Safety is not established yet in testosterone.
Yeah, and that's a crazy thing that people think. I mean, we've kind of gone through all of these things that talked about it being safely used, and really testosterone therapy was initiated in women in the 1930s, and it started with pellet therapy in men as well. So it has been used for almost 100 years, and it's very safe. And honestly, women do very well with it. They have a lot of significant benefits. It really helps with clarity, moods, energy level, their physique, bone density. So I don't know how anyone can say that. I mean, I think it really has a dramatic impact on people's lives. And then the other thing is, when we realize that when people are in their younger years, in their teens and 20s, that's when their testosterone is the highest. So those are the healthiest people. So we know that just having higher levels is very protective. And really the problems happen when the levels get lower. That's when all of the things kind of manifest themselves. So that one I think has been sufficiently debunked.
So would you recommend women on testosterone therapy or in hormone therapy that are having symptoms or low lab results with symptoms?
But you don't necessarily want to treat low lab results. You want to treat people who have symptoms of low testosterone. And so, someone could have a high number and still be symptomatic, and someone could have a low number and not be. So that's where you want to start treating people, men or women. You want to treat them when they definitely need it. Typically women start dropping in their late 20s, early 30s, and it starts to drop during that point. Then they take another bump drop down when they go through menopause, because a significant portion of their testosterone is produced in their ovaries. So when that happens, when their ovaries start producing, there's another big drop, and that's when they start feeling it.
Okay, all good information. Is there anything else that you wanted to add on testosterone therapy in women?
No, I think that it's very commonly done. It's been used for almost 100 years, and I think it's very safe and effective.
And the
form of
most
therapy.
common forms that you would recommend?
I think the most effective forms are pellet therapy, which are bioidentical pellets, which means that hormone is the exact same chemical structure as the hormone in our body. It's plant-based, so it's derived from a plant and compressed into a little tablet that's inserted under the skin. Those slowly release over a period of 4 months. Then there's also injection therapy, which is another way of getting testosterone. I would not consider oral therapy or some of these other forms. I think those are the two most
What about
effective.
creams?
Creams are okay. They are absorbed, but they just are inconsistent. Their levels go up and down, and you have to have consistency with application, and that tends to be a problem. So I think if you want to look for something that's going to give you the most consistency, which is why you're doing it to begin with, I think those other forms of therapy are the best.
All right, awesome. Well, thank you very much, and thank you for watching. Don't forget to comment and subscribe to our page.